All right, Dr. Sean Pruitt, welcome back to Pharmacist on Call, your host and your community pharmacist. Your doctors are busy, your pharmacists are busy. They don't have time for this hour. I do. So call in with those questions and those comments. We're going to finish talking about some of these supplements here. As I mentioned, we've got the topical form of hemp cream. I have not put it on the website yet because we just got it in like maybe a week or so ago. So you'll have to call the store. We can ship to you, and this is nationwide. We do have the Pharmacist blend pet hemp oil. So if you have a pet who is suffering from, anxiety, separation anxiety, he's a little bouncy and you need to settle them down. If your pet is suffering from like joint inflammation, which is common in pets as they age, safe for cats and dogs, by the way. So we have weight-based dosing on the bottle. So this is something that one size, it is not a one-size-fits-all kind of deal. I also wanted to talk about some of our other supplements while we've got a little bit of time here. Beetroot juice. So a lot of you always come in and you ask, hey man, what do you have natural for hypertension or diabetes? Well, it's going to be our beetroot juice. Let me pull it up for our buddies who are viewing on Facebook here. This is it. And so what this does, it helps treat hypertension, diabetes, cholesterol, even low iron. This is packed full of is a natural source of iron. So for those of you who are anemic and your energy is kind of sluggish, great source of iron. For those of you who are kind of locked up, excellent source of fiber. In fact, most people think it doesn't agree with them. It does. It's just cleaning you out and scraping those intestinal walls. Also great for the pancreas. Also has a compound that helps detoxify the liver and heal it called betaine, B-E-T-A-I-N-E. So a good liver detoxifier. So for those of you suffering from cirrhosis or maybe even hepatitis or just liver disease, a good alternative for you. I'd say the only people that we should probably use that in caution with, if you're someone who's taking Coumadin, which is a blood thinner, then you may not want to use it. But beetroot juice, easily our number 2 seller. Our number 1 seller is our alkaline water, our Kangen alkaline water. And if you don't know what that is, it's water that we take through about 3 or 4 different processes. We filter the chlorine out, we filter the fluoride out so it doesn't have a taste or a smell. We filter out all the pharmaceuticals that people put back into the water supply through their bathrooms. And what we do is we also electrify it. And so this water is teeming with cancer-fighting antioxidants. And then we adjust the pH up or down based on what we need. So in terms of being alkaline, any condition that you have related to having too much acid in your body, this water reduces the symptoms. So for those of you who are suffering from gout because of your diet, that gout goes away probably, maybe 12 hours or so, but certainly by the next day, the gout will be resolved. For those of you who are suffering from acid reflux and heartburn, it's gone in 15 minutes because the alkalinity reduces the hydrochloric acid within the gut. For those of you suffering from arthritis, same deal. Those should be able to move your finger. Those of you who have rheumatoid arthritis, those of you who are also suffering from diabetes, it gives the pancreas the alkalinity that it needs to help produce insulin and increases insulin sensitivity. So the pancreas needs to be alkaline to function properly. So this water helps it and gives it what it needs. Kidney disease, so the way this works is the water, because the kidney is our filter, or one of our filters, and we constantly put things in it that force the kidney to work hard. So the water is already clean, so less work that the kidney has to do. It also maintains acid-base balance as well. So it helps the kidneys keep alkalinity going in our body. But it looks like we've got us another call here. Pharmacist on call, may I help you? Pharmacist on call, how may I help you? Hello, Betty? Betty?
Yes.
Yes, ma'am. How may we help you?
Yes. I wanted to ask a question about the beetroot juice.
Yes, ma'am.
You said it was good for people who were diabetic. If you do not have a problem with being diabetic, would it be okay to take it for the cholesterol?
Yes, ma'am.
And the high blood pressure and those things?
Yes, ma'am. It has tremendous health benefits outside of hypertension and diabetes. So if you don't suffer from either one of those, but you happen to be anemic with cholesterol, then it's good for you. If you don't suffer from any of the other things, but you have liver damage, then it's great for you. Beetroot juice does probably 15 to 20 different things. All this coming from one vegetable, a beet. So
but
yes, ma'am.
Will it drive my blood sugar rate down too low?
No, ma'am. Now, you're talking about if you're already on insulin?
No. I do not take insulin. I have normal blood sugar.
Okay.
And I was wondering if it would drive it down and make it lower than it needed to be.
No, ma'am. So no, it won't bottom you out. Think of it like this, that the beetroot juice is putting the blood sugar back in balance.
Okay.
You follow me? Yeah.
Yep.
So it's not gonna, bottom you out like an insulin would. What it is, it allows the pancreas to function properly. The pancreas responds. So if your sugar goes too low, it secretes something called glucagon to push you back up. If it's too high, it secretes insulin.
Okay.
Yeah. So it just helps the body maintain its balance. Good question, though.
Okay. Okay. Thank you.
Yes, ma'am. All right. Thank you. All right. So, very good question. So we've got all right, we got one of our Facebook viewers here. For those of you in Facebook land, 615-737-7587. That's 737 plus PLUS. So that's the phone number if Facebook viewers want to call in with some questions. All right, so it looks like we've got Linda. Welcome to Pharmacist on Call. How may we help you?
Yes, you've talked about the hemp oil and the beetroot juice. You shouldn't be taking it if you're on warfarin.
Yes, ma'am.
How about Xarelto?
Xarelto, let me look up.
Okay.
Yeah, I'll need to see what enzyme system, because the issue is that the hemp oil will slow down the processing of some of these things and it will accumulate. And so we worry about blood thinners working too well. But let me see if Xarelto goes through the same enzyme system that warfarin does.
Okay.
Yeah, but if you could give me a call at the store, and we'll figure that out for you.
Okay. Well, thank you. I enjoy your show. Thank you.
Yes,
so much.
ma'am. And thank you for calling with a great question.
Thank you.
All righty.
Bye-bye.
All righty. Bye-bye. And that's the other thing regarding hemp oil. Guys, I know you want it, but be leery about going to health food stores. Every one of my patients, they get it. I counsel them. I ask them what medications they're taking. So you should probably get it from a pharmacy where you're going to get some counseling and then maybe an actual legitimate brand of hemp oil as well. But you can't just go and take this willy-nilly. You do need to speak with a health professional about it, so and make sure that you're not doing more damage. There are just some precautions that you do need to take with it. It is all natural, but not everyone is going to be a great candidate for it, okay? All right. Mary, welcome to Pharmacist on Call. How may we help you?
Yes. Where do you get the alkaline water? Where can you buy that?
Oh, you can come to the pharmacy. We're located at 811C Dickerson Pike. So if you know where Titan Stadium is, we're about a mile and a half from Titan Stadium on Dickerson Pike.
Well, I'm not in Nashville. I'm down here in Warren County.
I don't think there is anywhere near there that has the water. We haven't figured out a mechanism for delivering long distances, and it's too heavy to ship.
So you can't get it at Walmart or any drugstore here in McMinnville?
You can't get our water. Now you can get something that they may call alkaline water, but it's not as clean as ours. And so, that water that you're getting, I'm not even sure if the pH is even alkaline, but they haven't filtered anything out. So we triple filter our water, and we also alkalinize it. I'm not going to say what they do, but to get the best water, you'll probably need to make a drive to Pruitt's Discount Pharmacy.
Okay, and what was the address again?
811 Dickerson Pike, zip code 37207. Yeah, if you just put in Pruitt's Discount Pharmacy in your phone, it'll guide you to us.
Okay. All right then, thank you so much.
Yes, ma'am. All right, thank you. Jerome, welcome to Pharmacist on Call. How may we help you?
Yes, hello.
Yes, how are you?
Just fine. I have a question concerning the alkaline water.
Sure, go ahead.
Yes, how you doing today?
Pretty good. How are you?
On the alkaline water, how is it determined which the level of the water that I can get?
Okay, so
It's something about 90% or whatever number. I just want to know what level, if I purchase some, what level that I can purchase.
now it depends on what you're trying to accomplish, because each level is different. There are about 7 levels that we dispense, all the way from a pH of 2.5, which we use for cleaning, all the way up to 11.5, which you can soak your vegetables in. But in terms of health benefit, we usually dispense the pH of 9.5, and we also have a beauty water setting, which we use for women who want to beautify their skin, get rid of oil and dark spots, and also give it the pH for the hair to grow. That's called beauty water, which is more of an acidic pH. So it just depends on what you want to do. If you want to use it for arthritis, gout, and reflux, then you want to go to 8.5, 9, 9.5. We generally just start everyone out with the 9.5. If you're just looking for something clean to take with your medicine, we have a medicine water that's not too alkaline that will allow you to fully digest your medications. So it's more of a neutral pH. So it just depends on what you want to do.
Okay, thank you very much.
Yes, sir. Yeah, good question.
That's it. Okay, thank you.
All right, thank you.
Okay.
Welcome to Pharmacist on Call. How may we help you?
Yes. Dr. Pruitt,
Yes, ma'am.
this is Selma, your mother again.
Yes,
and
ma'am.
I wanted to mention that your aunt, Bonita, comes once a month to your pharmacy from Alabama to obtain her Kangen water, because she has tried it for a very long time and she swears by it and will not take anything else. So if she can come all the way from Alabama once a month to obtain the best in water, then it shouldn't be a problem for anyone else to drive here.
But she's already been converted. So yeah, I think the lady here was a newcomer to the water scene, so she hadn't really tried it to make the determination.
Once she tries it and realizes all the benefits, she will demand the Kangen water.
Yes, she will. Yes, she will.
All right, I just wanted to let you know that.
Yes, ma'am. All right, we appreciate it.
I'll remind people of that.
Yes, ma'am.
All right.
All right, thank you.
Okay, bye-bye.
All right, bye-bye. All right, yeah, my aunt, she drives all the way up from, I guess it's like Tuscaloosa, Alabama, somewhere around in there. All right, but look, we're up on another break. You guys stay right there. Call in with those questions and those comments.